Hi everyone, how you doing? Today, let's talk about what could possibly be the best dental implant for an all-on-4 kind of treatment. My name's Gus. I'm a cosmetic and implant dentist based just outside London in the UK, and we do a lot of surgical treatment, and one of the treatments we provide is all-on-4, which is kind of a way of getting a full set of teeth on dental implants for those people who we literally have no other option. Now, we've been doing this for a long time, and the implant systems which are used for this have been fantastic, okay? But recently I've changed, not because of the quality of the implant or anything related to that. It was actually because of the customer service I got from the implant company, and they weren't able to deliver the components on time for the procedures for my patients. And obviously this is a big deal because our patients really, you kind of build up in your mind about having this treatment. It's a big deal and I cannot let the patients down. So I swapped, okay? And I'm not going to tell you which company I used to use and which one I do use, because this isn't about that. This is more to just open your eyes that there's different design features which different companies have, and some of them are better suited for certain situations. Now, the implant that I'm going to talk about today is something which I generally use for the full arch stuff. So when I say full arch, what I mean is when we're replacing a full set of teeth on dental implants, whether we're doing it in a day or staged, when we're doing a full set of teeth, I have different requirements for the implant than if we're doing individual teeth or just bridges, short sections of teeth. So the first feature which this implant has, which other implants generally don't have, is that it has a coaxial. Now, what I mean by this is if you look at a standard implant, it's a cone shape. Okay, so it's got an axis going through the middle, and the screw which holds the tooth or the bridge or the abutment or whatever it is in this long axis of the implant. And this works really well because if we want to have some kind of angle correction, let's say we want to have an angled implant, which we typically do towards the back of the mouth, then the angle correction to make sure all of our kind of screw holes are finally in the right direction happens at the abutment. So we have a straight implant with an angled abutment which changes our angulation of the screw hole. Okay, now I understand this is getting a little bit technical, but just bear with me. So having a coaxial implant, it has what we call the prosthetic screw at a different angle to the long axis of the implant. This means we can put the implants in at different angles, but the screw head which goes into the implant is always in the same place. Now, this has a number of advantages. For example, when we're putting an implant in at an angle, the bone level to the front and the back of the implant is going to mean that the implant is in at different depths. But by having the top of the implant at an angle, we can now have the implant head at an even depth underneath the implant. This means that everything is kind of all in a nice straight line, and we're not worried about the implant being too deep or too shallow, which can often happen. And remember, the bone level isn't stable, so sometimes the bone level is going to shrink down, which means part of an implant may be exposed and part of it may not be exposed in the future if there's bone loss. So having this coaxial thing is quite a good thing. Now, another feature which a lot of patients ask me about, but nobody has ever seen the need for it, is when they're having a full set of teeth on implants, they think, okay, look, what if I go for the option with the clip-in teeth? Can I then, at a later date, change to kind of an all-on-4 fixed-in set of teeth? And the answer is always yes, but there's certain kind of limitations and it's kind of difficult to explain. Now, the limitation comes because we have to change the abutment, and the abutment angle correction which we have on an all-on-4 is maximum of 35 degrees, whereas the angle correction on a clip-in set of teeth is 17 degrees. This means if we were just going to change one for the other, our implants wouldn't be coming out in perfect straight line from the gum, or the abutments wouldn't be coming out at a straight line from the gum. Now, this is usually not going to be a problem if we were ever going to do this, but it's nice to have the option with a coaxial implant that whatever abutments we use, they're always going to be a straight abutment. So we literally can swap and change whatever we want on top of these implants, and there's no restrictions or angle variations that we can't have. Once the implants are in, everything that fits on top of the implants is standard. Okay, and that's a really neat thing from a surgical point of view, or when we come to restoring the teeth on the implants. Now, this coaxial thing also has an advantage at the front of the mouth in trying to maintain gum. So in some situations, we might actually get away with not having to do bone grafts and tissue grafts because we have this coaxial design. But maybe I'll cover that in a different video. This is mainly about a full set of teeth on dental implants. Now, the other thing that this implant system has, which is pretty cool, is that it has what's called an external hex. Now, the way that the abutment fits onto the implant varies. You see, you have the implant, and then most implants will have what's called an internal hex. Okay, so that means the hex is sunk inside the implant, and the abutment, which will effectively have the external hex, will fit into there. And then you have a screw which tightens it all together, and the hexagon just stops it rotating. Internal hexes work great, but an external hex has a slight advantage, mainly in strength. Now, I'm going to go completely off topic here, and let's talk about cars. Okay, let's talk specifically about Mercedes-AMG. Mercedes-Benz and AMG used to be two separate companies. In fact, AMG was founded out by some enthusiasts, and what they did was modify a standard Mercedes engine to make it more powerful. And then the engine M157 engine, I think it's called, was the first engine completely designed by AMG. So this is a big deal. But this engine had a really big problem. You see, the cylinder heads would come off the engine, okay, in some of the earlier cases, earlier engines. And the reason for this was the bolts which held the cylinder head to the actual engine were an internal hex bolt, and all that was needed was to change that from an internal to an external hex. This means there's more metal there, which adds strength. Okay, now a car engine is probably going to put more force on these bolts than anyone is having an all-on-4. But having an external hex to the implant is beneficial because it makes it a stronger implant. And on an all-on-4, the actual emergence of how the implant comes out of the gum isn't important because that's completely hidden by the lips. So the aesthetics in that zone isn't important. So having an external hex adds strength without any compromise. So in my mind, that's a pretty good thing. Now, the next thing, or the third thing I should say, with this implant is that it has a different surface at the neck of the implant compared to at the tip. We want our implants to have a rough surface. Rough surface is good because it increases the surface area that bone can attach to this implant, makes it a stronger integration with the implant. And that's all well and good when the implant is placed, but let's talk about 10-15 years down the line. If we start getting gum recession around an implant and that implant surface is rough, the gum recession is caused by bacteria. Bacteria are going to sit on this rough surface and make it impossible to clean that junction where all this inflammation is caused by the bacteria. Now, if we have a semi-smooth surface, what we are able to do is, if there is recession in the future, we're able to smooth off the surface of this implant much more easily, and therefore making it easier to clean if there was ever recession around an implant after having an all-on-4. So again, this is something which we hope we'll never need, but it's nice to have this feature just in case. Now, having the tip of the implant nice and rough keeps that roughness for the integration, so we have almost the best of both worlds. Now, every implant system has its advantages, right? The system that I used to use used to have a certain coating which allows blood vessels and blood cells to sit on top of the implant much more quickly, allowing it to integrate more quickly. It had other features as well which were really neat and specific to that system. Now, the truth is there's no one best implant or best implant system. We kind of pick and choose, and I use certain implants in certain situations and others in other situations because it's more dictated where aesthetics is important or strength of the implant is more important. What's the most important feature? Implants will stick. They're all made from titanium. The materials are pretty good. Some of them are weaker. We've seen cases with people who've had implants for 10, 15, 20 years and the implants break, or other problems occur with these implants. So in the long term, implants are going to break, just like natural teeth are going to break. Stuff can happen, but you want to minimize that stuff. And that's where thinking about the micro details on the types of implants can sometimes be really beneficial. So that's it from this video. I hope you found this video useful. I hope you found it interesting. I know a lot of people who are thinking about this, having this kind of treatment done. Do you find knowing about this kind of stuff quite interesting? I know I would. So, please give me a thumbs up, consider subscribing if you found it useful, and I will see you soon in our next video. Take care.